Good morning, good afternoon, good day, and welcome to today's webinar on social protection responses to COVID-19, challenges, opportunities for urban settings in sub-Saharan Africa. This is the 28th webinar of the Social Protection Responses to COVID-19 webinar series, and I'm sure many of you have joined us for previous sessions, so welcome back. The series is a joint effort initiated by the IPCIG, GIZ, on behalf of the German Federal Ministry for Economic Cooperation and Development, the BMZ, as well as the Australia Government's Department of Foreign Affairs and Trade. It is run in collaboration with the socialprotection.org platform and also in cooperation with partners from different organizations. The webinar series is part of an initiative with two other main components, namely a collaborative mapping of country news and documents disseminated through a weekly newsletter, as well as an online community on the topic to systematize information and foster discussion. So if you haven't done so already, we invite you to join the online community. It's called Social Protection Responses to COVID-19 Task Force, and it can be found on the socialprotection.org platform. In the community, you can learn more about the initiative, find out how to collaborate, and also to keep updated about future webinars. Speaking of future webinars, the next two webinars of the series will take place on Thursday, the 27th of August, and on Tuesday, the 1st of September. These two webinars will focus on the gendered impacts of COVID-19 and social protection responses in rural areas, as well as on the inclusion of persons with disabilities in social protection for COVID-19 recovery and beyond, respectively. So don't forget to register. The links will be posted on the chat box, and they can also be found on socialprotection.org and on social media. Before we get started with the presentations, I would like to introduce today's panelists and of course thank them for taking the time to present today and to share their experiences and insights on the topic. As you can see, we will have 4 presentations today, starting with an introduction into the urban aspect of social protection, followed by examples and experiences from different countries in the region. My name is Lena Gronbach. I will be moderating today's webinar, and I'm also a researcher and PhD candidate at the University of Cape Town in South Africa, working on social cash transfers and payment systems in the region. Our first panelist today is Krishna Pahari. He's the head of the Research, Assessment and Monitoring Unit of the World Food Programme's Regional Bureau for Eastern Africa. Krishna has worked in several countries in Asia and Africa over the past 15 years and has led numerous studies, assessments and projects related to food security. He will be joined by Donatien Begui, who is a senior statistician and demographer in the data and statistics section of UN Habitat based in Nairobi, Kenya. He has led different research studies in several African countries, providing technical guidance on data collection, analysis, and dissemination. Our second speaker is Taylor Spadafora, who is a social policy specialist in the UNICEF Eastern and Southern Africa Regional Office. She currently provides advisory support to UNICEF country offices on social protection and emergency cash transfers, and has advised governments in various African countries, both for UNICEF and also as an independent consultant. Our next speaker and our third panelist is Erika Matilone. She is Chief of Social Policy and Evaluation at UNICEF Madagascar, where she manages the social policy portfolio and works on advancing children's rights. She has also held several positions in different countries within UNICEF and has worked, among others, with UNDP and the European Commission. We then have our 2 panelists from the DRC. First up, Jules Simpezebanga. He's an advisor to the minister in charge of water resources and electricity in the North Kivu region in the DRC. And he has been working in this role since 2009 and has a background in engineering as well as professional training for youth. He will be joined by Claire Espe, who is a water sanitation governance advisor working with Mercy Corps in the DRC. She has also managed several international public health, water and sanitation and hygiene projects in East Africa, and she will be joining Jules and also translating the presentation today. Last but not least, before we get started, just a few housekeeping points. We encourage you to submit your questions to the panelists throughout the session, and we will do our best to address all of them during the Q&A session, which will take place at the end of the webinar. If there's not enough time to answer all of your questions, we will prepare a written document, which will then be shared with you via email and will also be made available on the socialprotection.org platform. So by joining the community, you will then also be able to participate in the follow-up discussions. In this webinar, only panelists and admins will be able to use the chat function. So please use the Q&A button at the bottom of your screen to submit your questions. When you do send your questions, please also indicate who the question is addressed to, and feel free to include your name and your institution or organization as well. And of course, feel free to post and share content, comments about the webinar on social media using the hashtags you can see on the slide. All right, so without further ado, let us get started with our presentations, starting with Krishna today. Krishna, the floor is yours.
Thank you very much. Good morning or good afternoon as it is applicable to you. I'm going to present this work, hearing me well. I would like to present this paper on the impact of COVID-19 on urban livelihoods, food security and nutrition in East Africa, which has been recently conducted jointly by UN Habitat and World Food Programme. I'm presenting this on behalf of the two organizations. My colleague Donatien from UN Habitat is also with us. Yeah, in terms of urbanization, even though East Africa is one of the regions where the urbanization is less urbanized compared to other parts of the world, but there has been steady increase in urbanization over the last several decades. As of now, almost a quarter of the population in East Africa, they are living in urban areas. Out of 60 million people living in urban areas, some 58% or 35 million, they are living in urban areas. Among them, among the 60 million people in the urban areas, 58% of them, they are living in informal settlements or slums. That shows how the urbanization has been in East Africa, which is not planned. People are living in urban areas without very basic facilities. As you can see in the slide on the bottom left, there are as many as 42 to 90% of the population living in slum areas in the region, depending on the city. And also there are people with very few basic facilities. Among the urban residents, even the basic hand washing facility is not available for most residents. Less than 1/4 of the population, they have access to basic hand washing facilities in their own premises. From the analysis of the satellite data, it's very visible, it's very clear to see this expansion of the urban areas in the region. This is just an example of few cities. For example, on the left, we have Kigali in Rwanda. You can see how much it has expanded from 1990 until 2015, from those dark black areas to now red areas in the new built up areas. Similarly, you can see on the top in Juba, in South Sudan, the urban areas have expanded more than twice. The built up area is now more than double of what it used to be in 1999. So because of this urban expansion and large proportion of these urban residents living in informal areas or slums, this poses a lot of risk in the context of COVID-19. We have also done some analysis done by UN Habitat on the urban risk associated with COVID-19, shows areas with different levels of risk in the context of COVID-19, as we can see in the map on the bottom here. And since majority of the urban population in East Africa, they are dependent on informal or vulnerable sources of livelihoods. As you can see from the graph on the top, they are only less than 30% of the livelihoods households, they have regular salaried income. And there is a dominance of informal sector income. For example, unskilled wage labor, petty trade, and etc. So which are very much vulnerable in the context of pandemic. As a result, we can understand, we can see that it will have significant negative impact on those livelihoods in the course of the pandemic. Even though there have not been, there have been quite some challenges in getting hard evidence from the field survey in the context of the pandemic. WFP has conducted so-called MVAM, Mobile Vulnerability Analysis and Mapping. This is based on mobile phone surveys we have conducted in a number of cities or even in the rural areas in the context of the pandemic. Here we have shown one such example of livelihood impacts in the urban areas of Uganda, conducted recently in the context of the pandemic. It shows that there has been a severe impact on the livelihoods. For example, particularly livelihoods, households dependent on handicraft, remittance, wage labor, transport labor, they have been most hardly hit by the pandemic in terms of their decline on their income. Even the people who are dependent on regular salary, they have also been hit hard by the pandemic, even though the degree may be less severe than those dependent on those wage labor, etc. And obviously, this severe erosion of livelihood resulting in decline in income has impacted households across the world, resulting in increase in food insecurity. This is true, generally true all over. But East Africa, you can imagine, it is the hotspot of hunger and malnutrition, one of the most food insecure regions in the world, even during normal times. You can imagine the impact in this region. For example, we have this global food crisis report for 2020, and there was a special focus on this region. It's called IGAD, Intergovernmental Authority on Development. It includes most of the countries in East Africa, and among them, just to give you an example of the statistics, 20% of the global population who are facing acute hunger, among the global population, 20% of them are from this region, whereas this region has less than 4% of the global population. So see the severity of the problem. So this IGAD region is very similar to the countries we analyze in our East Africa region here, except there is a difference of one or few countries. So if we look at the region where we analyze in our report, it has about 17% of the global population facing acute hunger in our area. And obviously, you can imagine malnutrition situation is also very severe. For example, in several countries, there are many regions, there are areas where global acute malnutrition level is higher than the emergency threshold of 15%. And another thing to consider is that this is already an area which have been suffering, where households have been suffering from multiple shocks. There has been series of recurrent droughts in the past. Recently there were floods in April, May. The households in the region have been impacted by the infestation of desert locusts since the beginning of the year. And on top of that, now we have COVID-19 pandemic. And then, as if it is not enough, there's now a possibility, which is still being analyzed, that there may be some La Nina effect from October onwards, which might result in drought conditions again. So this shows the gravity of the situation here. We have so many shocks affecting households. Food security and nutrition is already very, very serious. And now on top of that, COVID-19 is hitting us hard. So, in addition to this, what I would like to mention is that traditionally in the region, we have been considering the rural areas as prone to severe food insecurity. They have been the area where food insecurity was most severe. But because of the pandemic, now urban areas are emerging as the new hotspot of food insecurity because of the reasons I mentioned before. So many people, they are living in informal settlements or slums, almost 60% of the population in urban areas. They depend on very vulnerable households, livelihoods, and they have to depend on market, almost entirely on the market for their food needs, and their income has been declining. Even during normal times, for example, this graph on the bottom left, people, how a typical household in the urban areas, they have to spend as much as 40 to 80% of their income, of their monthly expenditure on food, with a very limited room available for spending for other needs like education, healthcare, etc. This is for average household. But for the poor households, the expenditure on food the proportion is even higher than this. And on top of that, now there is some increase in food prices, even though there is no major increase in prices, but there has been significant decline in the income of the poor households. That means their purchasing capacity their capacity for economic access to food has been severely compromised. Thus, it has added to food insecurity very significantly. Particularly, this has had a profound impact on the nutrition because they have little disposable income. For them, even to afford basic calorie-rich food for basic survival is now becoming a challenge. And to afford for a nutritious diet is becoming next to impossible for many households. That's why it's having more severe impact on the nutrition situation. So given all this, we have estimated that there were 24 million people who were facing acute hunger in this region prior to COVID-19. This has now increased to more than 41 million because of the impact of the pandemic. Among those 41 million, we estimate about 40 million people in the urban areas facing acute hunger. So this is a 73% increase in acute food insecurity. And our estimates, these are also aligned with the estimates from the IGAD. They have made food security and nutrition strategy in the context of the pandemic, and these are very much aligned. So this is showing the gravity of the humanitarian situation in East Africa, which calls for major efforts to address it. Our full report is available for download from this link we have shared, and you are welcome to reach out to us for any comments or feedback you might have. And last information, we are planning to work on such urban food security impact for the whole of sub-Saharan Africa for our next step. in our work by WFP and UN Habitat. I stop here. Thank you very much.
Thank you so much, Krishna, for this really insightful presentation, which it really illustrates the challenges faced by people living in East Africa, especially in urban areas, and also the additional risks that those regions face in addition to COVID-19. And just a quick note, the link has been shared in the chat. So if you would like to download the full report, then just click on the link and you can access the full document there. That being said, let us move on to our next presentation, which is titled Social Protection in Urban Contexts, Learning Lessons from COVID, and which will really zoom in on the challenges and opportunities of social protection in urban contexts. Taylor, the floor is yours.
Great, thanks so much, Lena, and thanks to everyone for attending today and for your interest. So this, just a little caveat, I titled this as social protection, but really for the most part, we're talking about social assistance, and even more specifically, cash transfers. So when you see social protection, think social assistance and think cash transfers. Okay, so very quickly, maybe not quickly, but when the slide changes. Okay, there we go. So far, our experience on urban social protection is that we find it actually isn't that prevalent, especially in sub-Saharan Africa. Most of the social protection systems actually have originated in rural areas trying to address rural poverty. And so there's very limited experience in terms of how do we implement in urban areas. Now, when social protection has been moved to urban areas, it's usually implied that it either replicates the existing social protection system that was in the rural area, or a whole new program will be designed that's exclusive only to urban areas, or there might be a simultaneous implementation in both urban and rural areas with some varying differences. Because we have such limited experience in urban social protection, we can't really advise on a best practice approach, and I think a lot of us have seen this during the COVID response. But we do know for a fact that just exporting the rural social protection program into urban areas is definitely not going to be the best solution. And there's two main reasons for this. One is that I'm sure we all know urban and rural poverty are extremely different. Families face very different challenges and experiences living in these two different living conditions. And also there's some very specific operational challenges that don't translate from the rural operations of social protection into urban social protection. Apologies, I'm getting the clicking. There we go. So to start off with urban and rural poverty being very different, of course, we know that those that live in rural areas, 80% of the global poor are living in these rural areas, and 2/3 of them are living off of agriculture primarily. Now, regards to urban poverty, it looks very, very different. We know that there are definitely higher living costs in urban areas, and there's a reliance on a monetized economy, meaning that they're not doing a lot of their own production in terms of food, and there really is no system for bartering or trading of goods and services that you might find in rural areas. There's, of course, also insecurity in employment and insecurity in housing. As Krishna has just mentioned, a lot of the urban poor are actually living in slums or non-permanent settlements, and that actually makes it for a very precarious housing situation. These populations are also much more mobile. A lot of them have migrated from somewhere else to come into urban areas, and so they don't have a set place where they absolutely live, and they might move from place to place. And that also has something to do, of course, with that insecurity of housing. Maybe they're forced to move around as they go. Apologies for the dogs in the background. And of course, we also know that in urban areas, there are weaker social networks between the communities. A lot of the neighbors don't know each other, they don't see each other, and they don't have that communal bond that you might find in rural areas. Now, just a very quick review on COVID-19 in sub-Saharan Africa. We have realized first and foremost that this is an economic crisis for sub-Saharan Africa. We have not seen quite the detrimental health outcomes that are seen in the rest of the world, but even before we started to see the epidemic levels of transmission and caseload, lockdown measures and a lot of the government measures that were put in place for prevention were actually having a really detrimental economic impact. Now, this prevented a lot of people from going out and seeking work or from being able to go to work. A lot of people also just lost their jobs. And there's a lot of macroeconomic factors that ended up slowing the economy, making prices higher, making it more difficult to find goods and services. And of course, as Krishna had mentioned, I mean, in sub-Saharan Africa, especially in Eastern and Southern Africa, this is just one more shock for families and for our countries, right? They're experiencing recurrent droughts, recurrent conflict. Krishna mentioned the locust invasion. There's also cyclones and flooding. So really, COVID was just one more shock for the countries and for families to have to deal with. We've also found that due to this idea of social protection being really based in a rural model, the shock response of social protection systems were not ready for an urban response for the most part. They were built for these localized shocks in terms of a flood or a drought that would be targeting a very specific population in a very specific area and not nearly as widespread as we saw for COVID. And they also were not going to be focusing on rural or on urban populations, as we mentioned before. Another factor is that the COVID impact is actually hitting a population that's maybe not classically determined or defined as recipients of social protection. So we're not looking at the poorest of the poor anymore, but these are informal workers that maybe a week or two before the economic shutdown happened, they were doing quite okay. They were able to feed their families, they were able to put their kids in school, things were going okay, but because of their nearness to the poverty line and because of their instability in terms of savings and having assets built up, as soon as they hit a shock, as soon as they lost a job, they were all of a sudden poor. And also we have found that many of the government social protection systems have been a bit slower to respond than we would like to see. Shock response of social protection is kind of an iterative process. It's slowly gaining some traction in the region, but very few countries and governments actually have responsive systems in place. This is not only due to operational challenges, but also to resource constraints and some political issues in some places. Now, just to be really, really clear here, we also just need to note that social protection coverage, and especially social assistance coverage, is extremely low. Now, this table is for the region that I cover, which is Eastern and Southern Africa, and you see on average only 14% of the population are actually accessing safety nets at the time. And if you were to take out South Africa from that mix, the average would drop down even lower, probably closer to 6%, 7%. Now, moving into some of the challenges for urban implementation of social protection. These are very general. This is definitely not an exhaustive list, just a little taste for you. But one of the big ones in terms of translating rural social protection into urban areas is targeting. Now, we know that the households look very different than they do in rural areas. They're not always familial. Sometimes they are a couple different people from different families sharing accommodation. They're also not always having a house, right? We have a very big challenge in terms of how do we take these social protection programs that have previously been looking at household level poverty and bring it into an area where some people actually are homeless or have very, very insecure housing, and you might not be able to target them as a household. Vulnerabilities are also extremely different, and the proxies of how you would gauge or measure poverty are extremely different than what you would do in rural areas. So for example, we usually look at housing materials in rural areas, but if you had a brick house with an iron sheet roof, you would most likely be considered better off than your neighbors in that rural area. However, in urban areas, we definitely know that that's not the case, especially when you're living in insecure housing or in some of these densely populated slum settlements. You might have brick walls and a roof over your head, but that doesn't necessarily mean that you are well off. Of course, there's also examples around different assets. Almost everyone in an urban area has a phone. A lot of the times they have access to electricity. So these are some of the issues that we need to work out in terms of how do we define urban poverty and how do we target these programs in urban areas. As I had mentioned before, the community ties and structures are definitely weaker in urban areas. And we know that in rural areas, there's always some level of community, either validation or verification or even communication about social protection programs. And unfortunately, in rural areas, that model doesn't really work out very well. And finally, we all know that the expenditures are much higher in urban areas. If you've ever lived in a big city or lived in a small town and then moved to one or the other, you'll be very surprised to find out that the costs are going to be extremely different. Everything from housing to food to your basic necessities. Now, when it comes to registering and enrolling beneficiaries for an urban social protection program, we have found that verification is much more difficult. It's very difficult to go and find someone, partially because of their mobility and because of the very densely population area. Maybe they're living in a different community or a different neighborhood, but they came and enrolled in your neighborhood. So a lot of those little sticky issues and operations are very difficult to find. And also, just in terms of the economy and the way these people are earning their livings, the time costs to sit around and actually participate in registration and enrollment that might not outweigh the benefits for a worker of going to do daily wage labor. So maybe they will know for sure that they'll make an income, a wage that day. They won't know for sure if they'll be selected on the program, so they might choose to not even try to be selected for the program. Now, when it comes to payments, there is one very obvious positive of doing urban social protection that we've found, and that is that looking at innovative and advanced technologies for payment systems is actually much easier in urban areas. There's a lot more access to banking, ATMs, mobile money, cell phone coverage, you name it. So this is actually one area where urban social protection can kind of win out. However, the benefit level needs to be higher and compensate for the cost of living in urban areas. And we have found that has been a very difficult conversation, talking with governments who are very worried about the fiscal envelope for these programs, and also not wanting to make an incentive of having higher benefits in urban areas so that people from rural areas would be incentivized to move into urban areas. So we really need to look through that. And then finally, monitoring is also going to be a big issue. When we have a more mobile population living in unsecure housing, it'll be a lot difficult to track them down and to find them. And also using some of these automated systems in terms of payments and some of the technologies for targeting, you will most likely have much less contact with your target population. And this is also applicable to the social welfare workforce, who maybe don't have the same relationships or the same amount of time to be able to reach all of the families in their catchment area. So you won't be able to rely so much on that. Now, of course, there's a lot of other implementation issues to look through, but these are just a few, like a snippet of some of the challenges that we see. Okay, and finally, one thing that we're really trying to identify is what can be the silver lining of COVID, and what are some of the windows of opportunity to learn from this experience and to push the conversation in social protection forward. So first and foremost, I think a big element that we can learn with all of these COVID responses, that majority are actually targeting urban populations, we can generate some of this information and answer some of these questions that we didn't know about. So what are the indicators for urban poverty, and how are urban households structured, and how can we actually address that when we're targeting social protection toward them? We can also use this opportunity to make the case for inclusion and expansion of these registries to include urban populations. Very often they're only looking at rural folks, and they're actually not even addressing or touching or prioritizing the urban areas. Now, there's one country in the region that has just launched their registry to include urban population, and that's fantastic, in Lesotho, and pretty soon they're going to have a registry for the whole population. And we'll see, of course, in terms of shock responsive social protection, having a more inclusive and comprehensive registry will vastly help the response time and the capability of government in future shocks. We also need to maybe rethink this current mentality around social protection for only the poorest. Now, we know there's a lot more social protection out there besides cash transfers and social assistance. There's health insurance, there's pensions, there's social insurance, there's all these other modalities that even some of us probably have access to and are really depending on. But I think the shift to looking at targeting for informal workers and for the urban poor will help us to try to broaden this out into a more rights-based approach to social protection and really make it more inclusive to all populations that might need support. And then finally, and last, but definitely not least in my book, is the opportunity to create some meaningful linkages, or what we in UNICEF call Cash Plus, with other services. We've been really trying to make these linkages in the past, trying to figure out how to make this work the best. And I think there's a lot of really useful lessons that we can learn from the countries that have managed to implement in their COVID responses in their urban areas, because a lot of them have focused on tying in wash, sanitation, to couple this in with reducing the spread of COVID and also making these vulnerable families a bit less vulnerable to the actual health impacts and spread of COVID. So with that, I will thank you very much. I am going to put a couple links in the chat. One is a very comprehensive, but a little bit old urban safety net review that was done by Ugo Gentilini from the World Bank. And I'll also put in a link for a paper that was recently put out looking at urban safety nets. And with that has a couple of really interesting case studies to look at. So thank you all very much.
Thank you so much, Taylor, for this short but very comprehensive overview of the implications of social protection or social assistance specifically. And I think that really gave a nice, how do you put it, it set a stage for the next two presentations, which will now really go into the implementation and give examples of how these social protection initiatives can look and work out in practice. And also, yeah, thanks for sharing the links. I think that will be very interesting for our audience. And yeah, thank you so much. We're moving on to our next presenter, which is Erika Matelone, and she will speak about the urban social protection response in Madagascar, and especially on the cash transfer program that was introduced in response to COVID-19. Erika, over to you.
Excellent. Thank you very much. I hope you can hear me okay, and good morning or good afternoon to all the colleagues and participants online. After these two excellent presentations, I will try to present the operational side of the social protection response to COVID-19 and present the response in urban areas here in Madagascar. I'll give a brief outline of the lessons that we have learned so far and also of the challenges that we have faced now 5 months into this protracted emergency. So let me move next. Let me see. Yes, here it is. So first of all, let me provide a quick overview of the situation in Madagascar in relation to poverty and inequality before COVID-19 hit in March this year. So despite sustained economic growth in recent years, Madagascar ranked 161 of 189 countries on the Human Development Index. And according to the International Poverty Line, more than 74% of the population lives with less than $2 per day, and 11 million of them are children living in poverty. It's estimated by now that poverty will increase as a consequence of the economic fallout, and we expect that increase to be around 9 percentage points by the end of 2020. This increase in poverty will be higher in urban areas, leading to additional 2.3 million poor in Madagascar, including 1.3 million children that are disproportionately more affected by monetary poverty. Social protection is currently at the forefront of the COVID-19 immediate response, and what we are trying to address is not only the health impact of COVID-19, but also, as Taylor said before, the economic consequences and the socioeconomic impacts. So it's a core pillar of the socioeconomic recovery plan of the government and also the UN socioeconomic recovery plan. In Madagascar, social protection response is quite unique and innovative. It's characterized by a single harmonized strategy that has been put in place by the Cash Working Group under the leadership of the government, working in close partnership with humanitarian and development actors like UNDP, WFP, UNICEF, the World Bank through the National Social Protection Implementing Agency, FEED, the European Union through CARE, Action Against Hunger, Humanity and Inclusion, De l'Or Sans Frontières, SOS Village d'Enfants, and the Malagasy Red Cross. The cash response put in place, it's locally known as Tusika Famino, filling the gap in English, and it's a multi-sectoral and unconditional cash transfer. The amount of the transfer is set at about $26 per household, and beneficiaries include the most vulnerable households in urban areas that have been affected by the lockdown put in place to prevent the spread of COVID-19. They're mainly informal workers that lost their daily job, daily revenue, but also vulnerable groups like single parents taking care of children, people living with disabilities, and so on. And key features of the response are a common targeting methodology that we put together in place through the CASH working group, a joint monitoring and evaluation plan, and a communication strategy for the entire operation. So if we look at the implementation process, the implementation of the social protection response in Madagascar included a first phase of pre-registration of beneficiaries in urban areas. We needed to know who they are. And it's important to know that these people were not previously benefiting from social safety nets, as the National Social Protection Program mainly cover people living in rural areas. And coverage, as Taylor pointed out before, is relatively low in Madagascar. Data were then clean and score were used to identify the most vulnerable households. And we started the first payment about a month after the declaration of the national state of emergency back in April. We conducted an in-depth review after the first payment, especially to correct inclusion and exclusion error, and also strengthen the implementation of the program for the second payment that started in July, and it will be concluded by the end of this month. Initially, we targeted 189,000 households, but then as more urban areas were affected by COVID-19 and also more funding became available, we managed to support 240,000 households, reaching out to about 1 million people with a mobilization of resources of $15 million. So what have we learned in the past 5 months? Well, there are some early lessons that we have identified in the CASH working group that I think are worth sharing. The first one is coordination. For us was really key. The CASH working group led by the government in Madagascar ensured timely and effective coordination of a response and really provided a forum for designing, implementing, and monitoring the social protection response, but also linking it up with the national social protection system. Second, in terms of pre-registration and targeting, we developed single lists that were used by all the partners involved in the implementation of the social protection response. We faced some difficulties, especially in implementing only mobile money. This is because of low telephone penetration rate among beneficiaries, even in urban areas in Madagascar. So during the first payment, the distribution of cash in a more traditional way caused some problems of crowd, and we learned then along the way how to better manage this in the second payment. The leadership of the government institutions, not only the national government, but also local authorities was key, especially in the dissemination of messages about the social protection response at the community level and also at the institutional level. And we also try to build some links with other programs. For example, we introduced behavior change messages to promote the control of the spread of COVID-19, but also to prevent gender-based violence. And we work very closely with the WASH cluster, improving access to water and soap that are key in preventing the spread of COVID. Right now, what are our perspectives? Well, we are looking on a medium-term response phase, and we are revising the strategy to develop a medium-term social protection recovery response, most likely until the end of 2021. Resource mobilization efforts are ongoing at the national level and also working with development partners. So this is the story about Madagascar, and to illustrate better the social protection response in Madagascar, I've got a 1-minute video that Corinne will now put on the screen. Thank you so much for listening.
Yeah, thank you so much, Erica, for your presentation and for sharing this really interesting case study. Yeah, I think the case of Madagascar is such a good example of how such a program can be implemented in a very short period of time, and also through a very close collaboration of government and other stakeholders. So thanks so much for sharing that. Before we move on to our last speaker, just a quick reminder to submit your questions through the Q&A function. We already have quite a few questions coming in, but yeah, feel free to drop them in the Q&A section, and also just don't forget to indicate who you are directing the question to. Now, as I mentioned previously, our last presentation will be delivered in French with consecutive translation to English, and the slides will also be presented in English to make sure that everybody will be able to follow. Jules and Claire, over to you.
Thank you. I'm Claire.
Et moi, c'est Jules Simpeze Banga. Je suis conseiller du ministre provincial en charge des ressources hydrauliques au Nord Kivu, en République démocratique du Congo. Alors, merci beaucoup pour l'invitation. Merci parce que nous allons partager avec tous les panélistes l'expérience du Nord Kivu sur la politique relative à la gratuité de l'eau pendant la période de COVID-19.
So thank you for the opportunity to share the experience of North Kivu in the Democratic Republic of Congo. We'll be talking today about the free water policy that the government instated in response to COVID.
Donc, ce que vous avez devant vous là, c'est la ville de Goma. La ville de Goma qui est la capitale de la province du Nord Kivu. Et la ville de Goma est située à l'est de la République démocratique du Congo.
So here you see an image of the city of Goma, where we are currently. It's the capital of North Kivu and home to approximately 1 million people.
Le contexte de la ville de Goma, c'est un contexte de déplacement important de personnes au cours des 30 dernières années. Et ce déplacement est lié aux conflits, aux catastrophes naturelles. Goma, c'est aussi une ville qui a été, disons, la population a été multipliée presque par 6, bien sûr avec la détérioration de toutes les infrastructures d'eau potable dans la ville de Goma comme dans la ville de Bukavu, qui est voisine à Goma.
Yeah, so just a little bit of context on access to water and sanitation in urban areas. We're focused on the eastern part of Congo. You see areas that have no access to piped water. Water service providers might include bicycles or trucks or tanks that people fill. And you know, the population has increased sixfold in the past couple of decades, and that's happening simultaneously as the infrastructure is deteriorating. And so this causes health problems in some of the peripheral areas of the city that are often the most vulnerable and the poorest.
Et alors, comme on a détruit les infrastructures d'eau potable par la présence de beaucoup de gens, beaucoup de déplacés, et le manque d'eau a été bien sûr la cause des décès chez les enfants de moins de 5 ans par la diarrhée, parce qu'il n'y a pas d'eau potable.
And so the absence of potable water in these areas has contributed significantly to a rise in diarrheal disease among children under 5 especially. And we estimate that several years ago, when the project that Mercy Corps is collaborating with the ministry on access, was approximately 40% of residents had access to water within a 30-minute round trip.
Alors, une forte donc incidence de choléra, il y a la mortalité infantile et bien sûr la violence basée sur le genre, parce que les dames sont obligées de se déplacer à de longues distances pour chercher de l'eau potable.
And in addition to diarrheal disease, we have specific cholera is endemic, childhood mortality is high, and we also have higher rates of gender-based violence, some in particular related to the long distance and early times that people have to wake up to collect water.
Alors, la situation liée au Covid-19, comme vous le savez, la maladie a entraîné beaucoup de choses négatives, si on peut le dire ainsi, parce que la première chose, c'était la restriction des mouvements. Et la ville de Goma a été isolée à plusieurs reprises, sans contact avec l'intérieur de la province et même l'extérieur de la province.
So COVID came as a kind of additional layer of challenge to the public health and WASH challenges of Goma and other cities like it. There was, in response to COVID, a swift restriction of movement. Goma, for example, was isolated from all other towns shortly after the cases began to rise in Kinshasa.
La ville de Goma vit essentiellement du petit commerce. Et les plus grands mouvements commerciaux qu'on a à Goma, c'est entre le Rwanda et le Congo, la ville de Goma. Et donc, lorsqu'on a fermé les frontières, il y a eu un grand impact sur le plan économique.
A particular aspect of Goma is that we're right on the border of Rwanda, and a significant aspect of the socioeconomic life depends on small commerce and trans-border commerce. And so the border has been closed since the 18th of March, and that's had a significant impact on sociocultural life and also economic life.
Alors, pendant même toute la période de confinement, pendant qu'il y avait le Covid, pendant qu'on a fermé les frontières, il y avait des manifestations politiques, il y avait des manifestations sociales parce que la vie est devenue très dure et tout cela n'a pas facilité, disons, la résilience.
So also characterized this past couple of months, there have been a number of political demonstrations and people have their life has been interrupted by the closure of churches and schools, restaurants and bars, which have been closed for the past couple of months and only recently just reopened, but significant source of revenue for local businessmen and women.
Alors, donc on a fermé toutes les activités commerciales, les écoles, les restaurants, les bars. Vous comprenez que les revenus de la population étaient très réduits. Alors, il y a aussi un problème de données fiables par rapport à la surveillance et à la riposte. On a des cas, mais personne n'a les données exactes parce que tous ne sont pas recensés, tous ne sont pas identifiés parce qu'il n'y a pas assez de tests, mais aussi beaucoup restent à domicile.
So in DRC, one of the challenges that COVID brings is the lack of reliable data. The delay time to get testing results, limited capacity for surveillance. We're trying to chase a moving target, and the current caseload is probably an underestimation. There's 9,700 cases. That was of a couple of days ago. Most of those are in the capital of Kinshasa, but a significant amount in the eastern provinces, upwards of 500 in North Kivu and 295 in South Kivu. The deaths have still stayed relatively low, so that's also at least an encouraging observation.
Je peux quand même mentionner que Ebola, parce que le Covid est venu pendant qu'on était en train de terminer la pandémie aussi, la maladie à virus Ebola. Et cette expérience Ebola nous a quand même aidé à appliquer quelques mesures barrières, notamment le lavage des mains, le gel hydroalcoolique, le respect des distanciations sociales. Le problème se pose plus au niveau des cache-nez parce que les gens ne sont pas habitués à porter.
So COVID also came at the end of the Ebola epidemic, and so the habit of hand washing, hand sanitizer was readily available. People were already physically distancing and had changed greeting practices. The new measure for protection against COVID was masks, and that was something that the community has had to adapt to. There's also been a significant spread of rumors and misinformation.
Arrivé à la gratuité de l'eau, lorsque le Covid-19 est apparu en RDC, le chef de l'État a proclamé l'état d'urgence et donc les populations étaient obligées de rester cloîtrées à la maison. Et comme il y avait augmentation rapide des cas de Covid-19 à Kinshasa, le gouvernement s'est réuni rapidement et le gouvernement a décidé donc de confiner les gens chez eux à la maison. Alors à Kinshasa, par exemple, on avait un confinement total, donc on a réduit le mouvement de population et cela a entraîné une baisse considérable des revenus au niveau des ménages. Et le Conseil des ministres qui s'est réuni à ce sujet avait décidé rapidement, parce que tout le monde avait peur, tout le monde pensait qu'on resterait à la maison pendant une longue période. Le gouvernement a décidé de donner de l'eau gratuitement à ces populations-là qui sont confinées chez elles à la maison. Et cette gratuité-là a été prise à l'endroit des sociétés de l'État. Les sociétés de l'État, c'est-à-dire la société qui distribue l'eau, chez nous ici on l'appelle la Régie des eaux, et la société qui fournit aussi l'électricité. Donc ce sont ces deux sociétés qui ont été déclarées, donner des services gratuits à la population pendant 2 mois.
And so here's just a brief representation of the process through which the national government of the DRC determined that water and electricity through the state companies, Régie des Eaux and SNEL, would be free from May to June. It was essentially determined between interministerial advisory group at a national level and rolled out to all of the provinces. These state enterprises for electricity and water are primarily concentrated in urban areas. And so while there wasn't a specific target for this policy, the ones who were benefited were the ones that were living in the urban areas covered by Régie des Eaux.
Voilà, donc il faut noter ici qu'il y a beaucoup de zones qui n'ont pas bénéficié de la gratuité, surtout les zones rurales, parce que la Régie des eaux et la SNEL ne sont pas opérationnelles là-bas. Donc, il y a des populations qui vivent seulement dans les zones qui sont desservies par la Régie des eaux en eau potable qui en ont été bénéficiaires.
Yeah, so this policy was really mostly targeted towards urban areas, and the complementary interventions included additional infrastructure and also free electricity that was provided by a private company through negotiation to ensure that water was able to be pumped into the system. The system in Goma, for example, depends on electricity to send water through the city.
Alors,
okay.
Ok, alors vous voyez que la gratuité a entraîné beaucoup de choses. La photo ici à gauche, au coin gauche, c'est la Régie des eaux qui affiche en gras que l'eau est gratuite. Et cela a donc entraîné de longues files de gens sur les bonnes fontaines. Parce que la gratuité, en fait, elle concernait les domestiques, les ménages qui ne sont pas commerciales, les maisons qui ne sont pas commerciales, mais aussi les bonnes fontaines publiques où les gens s'approvisionnent. Alors,
so here you see a couple of images of the decision being rolled out. On the left, you can see the announcement, the communication that the water would be free. And below you see Régie des Eaux, which is the state-owned utility company, which is announcing this policy at the outset. And then to the right, you can see some examples of the consequences of this policy. People are lining up at the public tap stands, and lines are considerably longer than before. On the right-hand side, you see a photo. This is a tap stand which was set up next to the tap stand of a private operator, and the private operator lost all of his business to these public tap stands, which provided free water for that time.
Ok, alors ça donc les gens, ils ont multiplié par 10, par 20 leur consommation en eau, et ce qui a entraîné donc beaucoup de gens sur les bonnes fontaines. Et vous pouvez aussi constater que dans la ville de Goma, les sociétés qui n'appliquaient pas la gratuité de l'eau n'étaient pas beaucoup sollicitées parce que tout le monde voulait aller là où l'eau est gratuite, et ce qui entraînait donc une foule nombreuse. Mais la photo que vous voyez presque en bas de celle qui annonce la gratuité, c'est le gouvernement provincial qui avait négocié avec une société privée qui distribue l'électricité dans la ville de Goma pour alimenter la station de pompage de la partie ouest de la ville, justement pour arriver à rendre permanent la fourniture en eau potable.
Yeah, so I think I explained a little bit the photos already. I think it's important to note as well that the consumption increased dramatically by 10-15 folds for households which usually spend somewhere between 10 and 15% of their revenue on water each month, which is estimated to be 30,000 francs, which at the current rate of exchange is about $15 to $20. Il nous reste 4 minutes.
Alors, vous voyez les diagrammes que nous avons devant nous ici, ça montre qu'il y a eu des moments où on n'a pas eu de l'eau au robinet. Donc, cela, c'est dû au fait que beaucoup de gens, ils sont au robinet parce qu'on ouvre de 6h à 18h dans la partie nord de la ville. Mais les gens se réveillent même à 4h du matin pour venir attendre l'eau. Et chaque personne avait au moins 5 bidons d'eau, c'est-à-dire 100 litres qu'il avait puisé. Et donc, on vidait les réservoirs avant l'avant-midi. Donc, dans quelques 2-3 heures, les réservoirs étaient déjà vides, et donc on avait plus d'eau au robinet.
So what you're seeing here is the tables from a water service provider that was subcontracted from the state utility company. And these are the figures of their hours of interrupted service and quantity of water reduction. So you can see a large jump during the month of May, for example, in the number of hours where the number of instances where there were shortages or cuts that lasted longer than 10 hours. And essentially what we saw, and I think we'll talk about it, we should, in the interest of time, move to the last slide. In demand, while it might have rendered water more accessible for some, ended up having rather the inverse effect and reduced the accessibility in terms of wait times and other issues that we.
Voilà. On a fini?
Presque.
Ok, alors la leçon apprise donc, c'est la fourniture, elle est gratuite, donc la société qui nous distribue de l'eau n'a pas de revenus, et donc il y avait beaucoup de difficultés liées au fonctionnement, parce qu'il n'y a pas de chlore, il n'y a pas de carburant pour activer les moteurs, il n'y a pas d'argent pour payer l'électricité. Donc, il y avait beaucoup de problèmes liés au fonctionnement de la société, mais aussi il y avait des problèmes liés à la sécurité, parce qu'il y a des femmes qui se réveillaient très tôt le matin pour être premières sur la ligne, et donc il y avait des problèmes sécuritaires, des problèmes de violence liés au genre. Mais aussi, il y a ceux qui achetaient de l'eau comme c'était gratuit, ils puissent de l'eau gratuitement, mais ils vont revendre à ceux-là qui ne sont pas prêts à attendre sur la ligne. Donc, il y avait des leçons qu'on a apprises là-dessus et des défis à relever. Merci beaucoup pour votre attention.
Sorry, I'll just point out a couple of these. We've already mentioned that the increased demand had an effect on long wait times and also on security. There was an increase in instance of gender-based violence because women and children who were responsible for collecting water were having to wake up much earlier and stay in line, even before daylight hours. One of the reasons why the lines were longer is people were reselling, so they would come with higher of canisters and jerry cans to fill, and then we're reselling it elsewhere. And one of the biggest challenges was the lack of income for the utility, as it takes a significant amount of money to distribute and treat the water and pump it and ensure that it's running through the system. They're unable to recover that cost and suffer some significant challenges because of it. So thank you, and thank you for your attention. And there's a video. Thank you, Karine, for sharing. This was an example of one of the areas of Goma City right after the policy began, and shows an increase in the lines. Thanks.
Yeah, thank you so much to our last two presenters and for sharing your experiences from the DRC. Yeah, as Claire said, the link is in the chat, so you can copy it and watch it individually. And yeah, I think this last example really illustrates the infrastructural challenges that many countries are facing, especially in fast-growing urban areas, especially with regard, obviously, to water and sanitation in the context of a pandemic such as COVID-19. And the provision of free basic services is indeed something we've seen in quite a few African countries, either instead of cash or in-kind aid or in addition to that. But I also think that, as you said earlier, the previous experience with the Ebola outbreak is definitely an interesting factor in terms both of the government response and preparedness, but also regarding the acceptance of certain measures and practices within the population. So thank you so much for adding that very interesting case study. And yeah, this brings us to the last part of our webinar, which is the Q&A session. We should have around 20 minutes left, I think, to answer questions from the audience. We have received quite a few already. I've tried to compile them and we'll post them to our panelists individually. And as I mentioned previously, if we don't manage to answer all of them, our panelists will have the opportunity to reply in writing, and the materials will then be shared after the webinar and on the socialprotection.org platform. I think to get started, I see the question has been answered in the chat, but I still think it might be interesting for the general audience as well. That's to Krishna by Omar Diop. He's mentioning that the decline of certain indicators needs to be explained by also identifying the impact of COVID on local food production and food imports. And he's asking if you can perhaps comment on this impact and whether that is reflected in the indicators used in your study, and especially how that applies to landlocked countries, which might strongly rely on either regional food production or food imports.
Thank you for the question. I tried to give a short answer also on the chat, but nevertheless, let me be very brief on this. This paper was mainly focused on the urban areas, but earlier we used analysis at the broad regional level, including both rural-urban dynamics, where we also looked into the local food production versus how much countries have to depend on the imports. Particularly, you mentioned a very good point, the landlocked countries like South Sudan or Uganda, they have more some increased vulnerability. Overall, in the region, in these countries analyzed, there is in terms of food balance, there is deficit in terms of total production versus what is required for the consumption of the population. Of course, there are variances. For example, Uganda exports a significant amount of cereals to South Sudan and also to Kenya, whereas Tanzania exports to Kenya and other countries, also to the southern countries. So there is this vulnerability of the imports now, because many people have to depend on the countries have to depend on the imports, but the currency, the disposable currency that is to be used for the imports is now under severe stress. because of the decline in remittances, decline in foreign exchange due to less revenue from tourism, etc., which varies from one country to another. So it has affected populations from that perspective in terms of the food production and supplies, and also due to the restriction impact on the overall supply chain globally and also in the region. There has been severe impact on the food security situation because of this, which we have explored, analyzed in more detail, and it is available in our earlier release of our regional reports. I put the link on the chat. You're welcome to go through it, and please reach out to us if you have specific questions. Thank you.
Thank you, Krishna. Thank you very much. Let's move on to the next question. We do have a few short questions to Taylor. So if you don't mind, I'll just read out 3 quick questions, and then you can maybe give a cumulative answer. So the first one would be, how do you account or consider remittances and the impact as a form of social protection in urban areas? And then could you perhaps also elaborate on the question of those new urban social protection registries? Which countries are moving in that direction? Where do these efforts currently stand? You mentioned Lesotho as an example. And then last but not least, seeing that you mentioned that verification is generally more difficult in urban areas, how does that play out in practice? Why exactly is it more difficult? And what could you recommend to address these challenges? Thank you.
Yes, thank you all. And I apologize, it's getting so dark here. I look like a floating head. But yes, thank you all for the questions. They're very good. Some of them I don't have answers to, but they're very thought-provoking. So the first one, in terms of remittances, now the presentation I made was purely based on formal government national-led social protection programs. And this is definitely a very context-specific issue. We know that several countries, for example, Somalia, is vastly dependent on remittances from diaspora, from outside of the country, and that is not usually factored into these programs. However, when they're doing targeting, they usually do ask, are you getting support from somewhere else? And so that can kind of factor into their vulnerability. Now, in terms of remittances internally in the country, it's often actually the urban workers who are submitting remittances back home, right, or back to their family in rural areas. But unfortunately, I don't have a concrete answer in terms of the scope or the scale of those, but it's definitely another one of those many, many, many operational complications that will need to be factored in when you're looking at urban social protection. And how do you measure this external support that families might be getting or that individuals might be getting from outside? So I'm going to just give that noted, and I think it's something that we definitely need to work through and find out how we can actually capture it and integrate it into our program design. Regarding the urban social protection registries, now in the region there are not that many complete registries. They're kind of a new trend that are going, and most of them have started in rural areas. I know Ghana, Kenya, Malawi, they all have registries, but again, they're very much focused on the rural areas. Lesotho has a complete registry for rural areas, and they've just launched their urban initiative to do the urban data collection for the registry just last week, I believe it was. I think it was the Prime Minister launched it from his garage. So that was very interesting launch and very interesting pictures from that. And I think as we move forward, this is going to be one of the cases and one of the advocacy points that we want to be making, that we should be including urban populations in these registries and maybe prioritizing them, right? Not only looking at the rural areas as the priority area that we need it, because shocks are also coming into urban centers, and we need to be able to respond accordingly and be able to identify vulnerable families, either for long-term support, long-term social protection, or for temporary response support. And then finally, in regards to the verification, I mean, that list I gave was extremely annotated and very, very short, just a couple ideas. But in terms of verification, there's a couple different issues. A lot of these programs really rely on a social welfare workforce to do a lot of the on-the-ground implementation. And even if they have external enumerators that are doing the data collection, it's up to the social welfare workers to actually go out and do some verification processes. Now, we know that it's hard to find any social welfare workforce that is actually fully capacitated with enough human and financial resources to do their full gamut, their very large envelope of work. But in rural areas, this is especially hard because there's obviously a lot more densely populated people and not a lot more social welfare workers. So that's going to be one of the key issues in terms of you'll need to find a different modality or a different mechanism to be able to do some of these verification exercises. There's also the idea that we talked about in terms of the community verification. With lower community ties, with weaker social networks in these urban areas, a lot of programs in rural areas really rely on going back to the community and verifying the list, right? And saying, okay, these are the people who've identified as poor, like who fits on it, who did we miss, you know, and there's a bit of a back and forth engagement. And that's a lot more difficult in these urban settings where people are not nearly as tight-knit. Also, the urban areas, as we had mentioned in terms of the difference in urban poverty, urban poor are often still working, right? And so they're not always home and they're not always available. I've always been really amazed when we go to rural areas to do any kind of implementation exercise, be it communications or targeting or registration, and you find that actually it's really easy to get a majority of the community to come together in one place. But if you go into urban areas, and we have some experience of this in certain countries like Ghana, where they were starting to do urban targeting, they were finding that the time frame of using that, you know, the working day window, people were not available and they wouldn't show up. So they actually had to do registration desks, enrollment desks in the evening hours so that people could access them after they had come home from work. And also, of course, there's just, again, this time cost. So people are not going to be wanting to stay home and be willing to be available to answer these questions when, again, they could be out making a wage. So it's just a little bit more complicated. I don't actually have concrete answers or recommendations. I think that's one of the key things that I'm trying to appeal to in this COVID response, where it's focusing mostly on urban areas, is how we can document some of these lessons and how we can learn from them to build them into broader social protection systems. So thank you. And I know there's a lot more questions in the box we probably won't get to, but I'll definitely make sure I can give some resources or some typed answers to them later on. Thanks so much.
Great, thank you so much, Taylor. And we do have one question which is directed to Erica, which relates a little bit to what you just mentioned with regard to the difficulties of targeting and also of registering beneficiaries in urban area. So Anita Auerbach and also Christian again are asking, how can you actually measure urban poverty? What are indicators that are commonly used? Can you name successful examples of how this is done in practice? And I believe in your case in Madagascar, that's probably quite a good example. So perhaps you could maybe just elaborate a bit further on that. And then if I may just add one of my own questions with regards to the payment issue in Madagascar, because you did mention that there were quite a few issues with the mobile payments initially. So I'd be curious to know a bit more of how that played out in practice. How were the cash payments organized? What role did the mobile money agents play? Were they supported? And also whether payments have now fully moved to mobile going forward, or whether there have been adjustments in that regard. Thank you.
Thank you. I will try to do my best to answer all the questions. So starting off with targeting, what I wanted to say also in relation to Taylor's presentation is that in Madagascar, we are in the process of launching a social registry, but of course it's not there yet. So when we had to work on the COVID-19 response, the first challenge was how do we identify beneficiaries and then target them for the response. So what we did was to use a self-registration approach. We developed a questionnaire with the cash working group to capture in people in the informal economy, but also people that may be particularly vulnerable, not only because of their income, but also because, for example, of the number of kids they have in the household, or on whether or not they have any people living with disability in the household. So we try to develop a very simple but effective questionnaire we could use for pre-registration. And then we did that relatively quickly. We managed to register people in main urban areas in about 12 days. And that was really a joint effort, especially on the part of WFP and the National Social Protection Agency that did the actual registration. Some of the challenges in that were that many people did not have some basic documents to be registered. So we had to work out how to get them registered in the Fokontany, which is in Madagascar, the local municipality first, and also give them all the information they needed in order to register. We also try to use a leave no one behind approach. So for example, for people that were not able to go to the municipality and self-register, we use our mobile registration office to go to some household that we knew were particularly vulnerable, and people were not able to go to the municipality to register. Also, and this is, I think, a challenge, especially in urban areas, also dealing with a health pandemic. Some areas where some municipalities ended up being particularly crowded. So we distributed numbers to people to go to the municipality to register at a certain point in time to avoid long crowds. It was not perfect, and that's why it was important for us to have a verification process along the way, and to verify the list not only with the municipalities involved, but also to do check with the agencies that were already present in some of these areas, and make sure that all vulnerable households were included. In terms of indicators, I mentioned before, we try really to focus on informal workers, but also use some indicators to capture some level of vulnerability. And when it comes to mobile money, we had some challenges in implementing that because of the low coverage in terms of mobile phones, even in urban areas. We then decided to go ahead with mobile money for some beneficiaries, and others continue to receive cash in a more traditional way. But we learned, for example, along the way, especially in the COVID-19 response, to ensure that there are sufficient points of payments to avoid long crowds, and also to put measure in place to avoid having people waiting for too long, and also respecting social distancing. So I hope I answered to the questions, and I'll be sharing more later with you all. Thanks.
Perfect. Thank you so much, Erica. And yes, we'll definitely be sharing more details after the webinar. We also have two quick questions for Jules and Claire. And the first one relates to the role of misinformation and the spread of fake news, which is, of course, something we've seen in many countries across the world, actually. And the question is, how do you assess government communication response and strategies to address these issues? And then the second question, just to clarify whether there have been any additional measures in response to the pandemic in the DRC, both regarding social services, but also possibly cash transfers or other social protection measures in the DRC. Thank you.
Thank you. So thanks to the question first, and we did write in a text, so I'll just summarize what Jules provided as an answer. Regarding the communications, obviously the DRC has some experience with developing protocols and the process of validating messages and tracking rumors. So they, at the outset, the provincial government in North Kivu signed a contract with all of the radios in the province, and those radios contributed their services to the effort. Messages were validated centrally and then translated into all local languages. So I think there are a fair number of implementing partners that are still in a transition phase post-Ebola, who are also able to support, and the COVID strategy is all centered around a COVID provincial strategy. So it's quite well structured and well organized by the government. For the second question regarding other additional measures that the government had taken in order to compensate Régie des Eaux, it's a great question. So the national government has offered to pay the personnel and costs of operations, including, chlorine, etc., for the Régie des Eaux. As Jules mentioned earlier, one of the main issues for water in Goma is electricity. And while there is a state company that provides electricity, there's a private company that also they negotiated to provide the electricity needed. So that reduced the cost of production significantly. I will note, though, that Congo Maji, for example, which is a company that's been subcontracted by Régie des Eaux to sell the water at the public tap stands, they may get a tax credit in the future to compensate for their lost revenue, and that remains to be sort of determined. I think it's an ongoing challenge.
Okay, great. Thank you so much. Before we wrap up, I would like to pose one final question to all our panelists, because this is something that has been asked by several of our attendees, and it's really a cross-cutting, overarching issue. So maybe all of you can just give a brief 30 to 60-second answer or statement on this before we wrap up. And the question is, how do you think these short-term interventions that we have been seeing over the past few months will impact social protection systems more broadly and obviously beyond the emergency stage? What's the role international organizations can play in this regard? How can we reach those additional segments of the population, such as informal workers, urban dwellers, to prevent future outbreaks and obviously to mitigate the impacts of such? And yeah, what are your views on the long-term impact of COVID on social protection systems, specifically with an urban lens? Maybe we can just keep our order, maybe just start with Krishna, and then Taylor, Erica, and Jules, and then we'll wrap up. Thank you. Krishna, you'll need to unmute. We can't hear you.
I'm sorry. I was saying that I'm not an expert in social protection system, but to give my view in one sentence, this COVID-19 is creating a lot of problems, but at the same time, while it's challenging, but it also provides some opportunity for us to improve the existing social protection systems. So, and then we have to design it accordingly so that we have a right and sustainable social protection systems in place that will help communities and households in the longer run, and also the national institutions to prepare better in the social protection of their citizens. That's very short. Thank you.
Thanks so much for really, I mean, that is going to be the question, right? From UNICEF's perspective, we really are looking to try to see how do we carry the lessons learned, the experiences that we've seen during the COVID response, and put it into more structural changes with government systems, and make sure that we can continue to improve upon government systems so that the next time there's a massive, large-scale shock, we can actually be a little bit more prepared and a little bit more ready to respond. And this is particularly relevant in these urban areas. You know, all those question marks that I had for urban, we don't actually have the answers yet. So a key strategy that we're hoping to do is to really do a concrete, in-depth review of how these systems managed to work, and maybe what didn't work so well. Where did the delays come in? Where did, you know, some of our assumptions were wrong? And see how we can improve on that, and really use it to inform government systems. One of the positive things that we've seen is the governments have been very, very keen to be able to respond with social protection. And that has been a very strong argument and a strong confirmation of the utility of social protection, not only for long-term support, but also in terms of times of crisis and in times when you need temporary direct support to individuals. So it's not really a concrete answer, but it's definitely something that we want to move forward and see how we can take this as momentum to really expand, looking into doing better urban poverty measurement, better urban targeting, and better urban design for social protection programs. So it's not really an answer, but it's kind of a call for all of us to try to carry this forward and make sure that it doesn't die out. And then also additionally, just looking at social protection beyond just response, but also recovery. I mean, as we know, with the economic impact of this crisis, it's not going to be over, you know, the minute that COVID is eradicated or is vaccinated against or whatever. So we really need to look at the long-term recovery opportunities that social protection can offer for these populations, and also for the government and for their economies, because we know that social protection really has some really positive effects on local economies. So it's more to come is what I will say. But thank you all for so much, and thanks for your attention and for your great questions as well. Bye-bye.
Thanks for a great question, and it's harder to add more, but I think for us it's very important to build on this COVID-19 response and move into a medium to long-term recovery response that uses social protection to make people less vulnerable to shocks. So this is in the direction in which we are trying to go, and also integrate what has been done during the COVID-19 response into the national social protection strategy. The challenge for us in Madagascar is that coverage before COVID-19 was very low, but the pandemic provided the opportunity to showcase the importance of social protection, and so we'll try to build on it and really make sure that slowly we increase coverage of social protection in Madagascar. And thank you so much all for your time and for your great participation.
Thanks, Erica. I think Jules is up, and we've just kind of responded quickly. I'll translate. So on the long-term perspectives, the provincial government requested of Mercy Corps, for example, through our ongoing infrastructure project, they requested more and more quickly. So we accelerated the timeline. We put some tap stands in places that high traffic, so like in the market, and those obviously will stay in place longer than COVID. So you know, there are some longer term kind of systems that this will serve beyond the life of COVID, and also they were able to, through the negotiation with the power company, accelerate the connection of a new zone of water within the city. And so that will stay operational and continue to serve beyond COVID. Thanks.
Perfect. Thank you so much to all of you. And yeah, that brings us to the end of our webinar. So let me just formally thank all our panelists again for sharing their insights on urban social protection responses to COVID-19. It's been an absolute pleasure and honor to host this session with you today. And thank you also to our audience for submitting your questions for the Q&A session. It's been a really engaging discussion. And even though we didn't manage to really answer all of your questions, our panelists will provide additional information after the webinar. And of course, also thank you to our colleagues from IPCIG, from the GIZ, DFAT, and socialprotection.org for facilitating the webinar series. And as Taylor said, I'm sure this issue of social protection in urban areas will continue to receive growing attention. So watch this space. I'm sure we will see more initiatives and changes also, or especially beyond the emergency phase. Last but not least, a quick reminder to also register for the next 2 webinars, which we mentioned earlier on. They will take place on the 27th of August, 1st of September, and to join the socialprotection.org community. Once you leave the webinar, you will see a short survey. It will pop up as you leave the webinar, and we would appreciate it if you could take 1 or 2 minutes to quickly complete the survey, just to help us further improve the webinars and also to address additional topics that may not have been covered in previous webinars. That's it for today. Thank you so much for joining. Enjoy the rest of your day and keep well.